Hi everybody, welcome back to UWorld's Next Gen NCLEX review session. My name is Jackie and I'm a nurse here at UWorld. We're so glad to have you guys with us today. We are covering integumentary questions or skin questions today. So if you are new to these question drill sets, what you can expect is we'll pull up the question, read it to you, give you about 30 seconds to answer, and then we will walk through why the correct answer is right. Be sure and use the chat. Nurse Samantha is moderating today, so be sure and say hello to her. And as always, we invite you to follow us on your favorite social media channel. With that being said, let's go ahead and jump in and get started. All right. Our first question, the nurse in the emergency department is assessing a client who has full thickness 4th degree burns to the torso and upper extremities. Which of the following findings would require immediate follow-up? Option 1, singed nasal hair. Option 2, presence of eschar. Option 3, 3+ edema of the upper extremities. Option 4, decreased sensation over the burn areas. All right, go ahead and drop those answers in the chat. We'll give you about 30 seconds to answer. I'm going to enter into the live myself so I can take a look at the chat. Again, if you guys are just joining, we're covering skin questions today. So everything about our integumentary system. We have about 8 questions that we're going to cover, and we're glad you guys are here. All right, I'll give you guys about 10 more seconds to answer. And again, welcome everybody. We're glad to have you here with us today. Awesome. Okay, good answers coming in. I'm seeing a lot of option 1. So you guys definitely have it. Option 1, singed nasal hair is going to be our correct answer. So kind of starting with this question, we see the word immediate bolded. So this is going to kind of alert us that we have a prioritization question. So we can kind of use some of our prioritization strategies on this question. So kind of keeping it in simple terms, the ABCs are some of the easiest ways we can prioritize findings or options choices, interventions even. So that's what we see in this one. Definitely airway is something we're going to be concerned about when we are talking about burns. And so what we see with if we see singed nasal hair on a client who's experienced a burn, we're worried about inhalation injuries. So essentially is that swelling in the airway. We want to identify that this has happened to the client immediately so that we can protect that airway. So that can look like early intubation before that airway swells up. If we wait too long to intubate these clients, that airway will swell, it can close, and we'll have to access the airway in a more invasive way like a trach. So definitely our correct option on this one is going to be option 1. What we see in options 2, 3, and 4, this is definitely something that we would expect to see. It's not so much indicating a complication. What we see in option 1 is their complication. Again, when we see that 4th degree, that means the burn has gone through 4 layers. So the epidermis, dermis, subcutaneous, and into that muscle. So we definitely have a pretty significant burn. We would expect to see eschar, which is that kind of charred appearance to our skin. We're definitely going to have edema. We're going to have some of that third spacing happening, and then decreased sensation as well. Those nerve endings are going to be affected when we have a 4th degree burn. So decreased sensation would be expected. All right, I'll move on to question 2. The nurse is observing a staff member caring for a client who is at risk for a pressure injury. The nurse should intervene if the staff member is observed. Option 1, placing foam protectors on the client's heels. Option 2, using a draw sheet to reposition the client in bed. Option 3, maintaining the head of the client's bed at 60 degrees. Option 4, applying a moisturizer to the client's skin after bathing. You guys are doing great. 30 seconds on the clock. Drop those answers in the chat. Thanks to everybody who's following us. If you guys are new to UWorld Nursing, this is your first experience with us, we're glad to have you here. We always encourage you guys to check us out at uworldnursing.com. It's kind of like our hub for all of our first timers in the UWorld Nursing community. We have our event calendar that you can subscribe to. We also have links to some of our best resources, our free trial, helpful tips, our blog posts as well. So check it out. It's a good first stop. As you can also see about our product and subscriptions as well. So very good, you guys. Awesome, awesome. All right, I'll go ahead and pull up our correct answer. So our correct answer on this one is going to be option 3. So what's kind of starting with the questions, kind of always our like first step is just to see what we have, what the question is asking us. So this says the nurse should intervene. So our correct answer is going to be the incorrect action. So we're looking for something that's not right to do, maybe not safe for the client, could cause a complication, anything like that. So we are looking to prevent pressure injuries. So pressure injuries can happen for all sorts of different reasons. Sometimes it's because of delayed or excessive like immobility, or we can have some other conditions going on that can be a risk factor for pressure injuries. But really what we're trying to do to prevent pressure injuries is just reduce that pressure on our bony prominences. And so having the client's head of the bed at 60 degrees, that's going to put a lot more pressure kind of on that sacral area. So we always want to encourage clients that have a high risk for pressure injuries to be more at like a 30 to 45 degree angle. So this would be what we would want to intervene on. That's going to put too much pressure on that sacral area. We have a lot of bony prominences there, and that's definitely something that we can help reduce that risk for pressure injury by leaning that head of the bed back, distributing our weight a little differently. What we see in option 1, 2, and 4, these are all measures to reduce that risk of pressure injuries. So foam protectors on the client's heels are going to help prevent that skin from breaking down, especially with movement in the bed. Option 2, using a draw sheet to reposition the client. This is definitely something the client would prefer and that you as a nurse would want to use to move a client. And then keeping, option 4, keeping that skin moisturized, preventing any breaks in the skin is definitely something we would promote as well. So good job, you guys, you did great. All right, question 3, the nurse is caring for assigned clients. The nurse should first assess the client who, option 1, has pneumonia and a temperature of 100 degrees Fahrenheit, 37.8 Celsius. Option 2 has cellulitis of the right lower leg and a heart rate of 130 per minute. Option 4 has ulcerative colitis and severe abdominal cramping. Option 4 has a history of a stroke and is unable to lift the arm on the affected side. All right, 30 seconds on the clock. Drop those answers in the chat. Again, if you guys are just joining, we're covering skin questions today. We have 8 questions. We're on question number 3. We're glad you guys are here. We're covering all sorts of different conditions, things from burns to infection. We have a lice question, medication questions. So hopefully we cover a good mix of things for you guys. But good work, good work. Awesome job, you guys. And as your answers are coming through, one of our favorite things to ask is if we have any new NCLEX passers on today, or if we have anybody who is testing soon. So let us know so we can wish you good luck or celebrate your wins, but we love to know that kind of stuff. All right, our correct answer in this one is going to be option 2, has cellulitis of the right lower leg and a heart rate of 130 per minute. So again, we see the word first bolded. This is a prioritization question again, kind of similar to that first one that we had. So we can use some of our prioritization strategies. So obviously we can apply the ABCs to this question, but we can also prioritize our options against each other. So everybody's going to need to be seen, but what are we seeing that is a expected finding? What is indicating a complication? What is an emergency? Any of that. So we can kind of just use our context clues for what's going on. But I think one of the most helpful things that I've always found is just looking for what is expected. So what you would expect to see in a client that has a condition versus what indicates a complication, like what, even though they have something going on, what is a complication of that condition? Something that's kind of taken things a step further than an underlying condition. So when we're talking about cellulitis, it's essentially inflammation, can even be infection of that subcutaneous tissue. A lot of times it's caused by a bacterial infection like staph or strep, following like a break in the skin. But essentially if we have an active infection and we have an heart rate showing tachycardia, we kind of have the beginning workings of sepsis. So we definitely want to prioritize this client. We want to intervene quickly on this client to ensure that our client isn't headed towards sepsis. So that's going to be our correct answer. What we see on option 1, pneumonia and a temperature of 100 degrees Fahrenheit, definitely something we want to keep our eye on. Again, we have an active infection, but 100 degrees Fahrenheit really isn't indicative of a fever yet. We would be worried at like 100.4 or 38 degrees Celsius, but maybe this would be like number 2, but not number 1. And then option 3, ulcerative colitis and cramping. These kind of go together for maybe signs of like an exacerbation. And then someone that's had a stroke and is unable to lift their arm on the affected side, we would expect this to happen, that we maybe would have some hemiplegia. So again, using that strategy of expected versus complication can really help us with these questions. So good work, you guys. All right. Question 4, halfway. The nurse is assessing a client with impetigo. It would require immediate follow-up if the client has option 1, pruritus, option 2, periorbital edema, option 3, honey-crested exudate, option 4, erythema surrounding the vesicles. All right, 30 seconds on the clock. Drop those answers in the chat. You guys are doing great. I think we have some on TikTok. We have a few upcoming test takers. Good luck to you guys. You're going to do great. Just be confident in what you know. You're going to crush it. You guys are doing great. Well done, well done. Oh, thank you to Nurse Kimmy, who used UWorld and passed. That's amazing. We love to hear that, and we're glad that you're still following us. That's good news. Good answers, you guys. Well done. Good job, good job. All right, I'll give you about 5 more seconds, and then we'll pull up the correct answer. You guys are doing great. And again, be sure and share this session. The more the merrier. We want to help as many nursing students as possible. We're doing these for you guys, so make sure and tell all your friends in nursing school. All right, our correct answer on this one is going to be periorbital edema. So again, we see immediate bolded. This is going to indicate this is, again, like a priority question. So we're looking for that finding that is indicating a complication, not something we would expect to see with impetigo. So impetigo is a type of strep infection. So one of the complications that we can experience with strep infections is acute post-streptococcal glomerulonephritis, which is essentially that strep infection making its way into our kidneys. So if our kidneys experience infection like this, we're going to have some inflammation of our glomeruli, which is, essentially what's going to help filter our urine and excrete those waste products. So if we're experiencing this, we're going to essentially go from our impetigo being a strep infection, that strep infection going to our kidneys, our kidneys experiencing acute kidney injury, and then symptoms related to that are going to present differently. So we can have some oliguria, which would be like low urine output. We can have edema, which essentially periorbital edema, so fluid backup in our body, which is what we see in option 2, hypertension due to fluid retention and weight gain, and then even hematuria, which is blood in our urine. So what we see with options 1, 3, and 4, these are things that we would expect to see with impetigo. They're kind of our hallmark manifestations of it, but we don't expect to see a client present with that periorbital edema. That means that infection has made its way to our kidneys are injured, and we're having manifestations of acute kidney injury. So you guys did great on that one. Well done. All right, moving on, question 5. The nurse is teaching the parents of school-age children about the treatment of Pediculosis capitis, or head lice. Which of the following information should the nurse include? Select all that apply. Option 1, wash your child's bed linens in cold water. Option 2, keep your child's fingernails trimmed short. Option 3, remove nits from your child's head using a fine-tooth comb. Option 4, treat all your household pets with a pediculicide. Option 5, seal non-washable items in a plastic bag for 10 to 14 days. All right, 30 seconds on the clock. Drop those answers in the chat. I think this is our first select all that applied question. So we're going to have more than one right answer. You'll always see those words select all that apply bolded, even on the NCLEX. Anything you see bolded is bolded for a reason. They, we want you to see those words. So anytime you see that select all that apply bold on your test, know you're going to have more than one right answer. And we don't have to be worried or afraid of these questions. We just have to kind of use our strategies to approach them. Kind of take everything one option at a time. But I know when I was in nursing school and I saw select all that apply. I was like, oh no. But the more you do it, the more you practice, the less scary they get. All right, good work, you guys. Okay, our correct answers on this are going to be options 2, 3, and 5. So again, we see the nurses teaching. We're looking for statements that are correct for us to share with the parent. So when we're talking about lice, we definitely want to focus on killing the eggs that are on the scalp. So we definitely know that we're going to have some symptoms associated with it, especially like extreme itching. So we want to keep our child's fingernails trimmed short. We don't want to cause any type of abrasion to the scalp due to itching, and then that could create a subsequent infection. So that's definitely a true statement, something we want to communicate to the parent. We definitely want to remove the nits from the child's head using a fine-tooth comb. So they like to kind of bury themselves, find themselves at the base of our hair follicles, so where our hair meets our scalp. So that's definitely something we're going to do, an appropriate statement. And then sealing non-washable items in a plastic bag for 10 to 14 days. This is going to essentially suffocate the lice, and they will no longer be active on whatever that non-washable item might be, maybe like stuffed animals. Option 1, we want to wash our linens in warm water, not cold water. And then option 4, we're not worried about lice kind of transitioning from the human scalp to pets. That's not anything that lice will kind of make a home on. That's just something that we would worry about with like human to human contact. All right, good job, you guys. Well done, well done. All right. Oh, I see someone asked what would be considered a non-washable item. It would be something like a stuffed animal, maybe something that can't go in a washer, anything like that, or something they wouldn't want to put in a washer. But obviously you want to wash like your linens, your clothes, hats, anything like that. All right, good work, you guys. Question 6, the nurse has attended a staff education program about pressure injuries. Which of the following should the nurse recognize as a risk factor for the development of pressure injuries? Select all that apply. Option 1, percutaneous endoscopic gastrostomy tube, or a PEG tube. Option 2, head of the bed maintained at 30 degrees. Option 3, urinary and bowel incontinence. Option 4, history of diabetes mellitus. Option 5, high protein diet. All right, 30 seconds on the clock. Drop those answers in the chat. You guys are doing awesome. And let us know too if you guys saw our live we did yesterday. Samantha did a lecture on maternal health. So we covered kind of main conditions of the antepartum, labor and delivery, like active labor, and then postpartum periods. So be sure and check it out. You can find all of our lives available on our channels. A lot of times it's easier to search for them on YouTube, but we hope you guys will check it out. We also had 3 practice questions on there too, so always good to do more questions. But good work, you guys. Awesome, awesome. All right, our correct answer on this one is going to be options 1, 3, and 4. You guys did great. Okay, so we are looking at risk factors for pressure injuries. So pressure injuries can kind of happen anywhere on our body that anything is touching it for a prolonged amount of time. So a PEG tube can definitely cause a pressure injury. A PEG tube essentially allows us to kind of bypass the upper digestive system to deliver food or medication into the stomach. So the bumper that is going to be placed you can kind of think of a PEG tube as like there's a bumper in the stomach and a bumper on top of the skin, and that's what holds the tube in place. And then just envision the tube going from the outside into the stomach. But that bumper on the outside on our skin, it can rub, it can be a little too tight sometimes. Even if some contents spill out, it can cause some skin breakdown. So that's definitely a risk factor. We always want to assess it anytime we're using the PEG tube, obviously anytime we're doing like a shift assessment, anything like that. So Peg tube, definitely something that can cause a pressure injury. Urinary and bowel incontinence, anytime that we have fluid or stool sitting on our skin, that can definitely cause skin breakdown. That's why it's so important to understand kind of how our client needs to be supported in those ways, making sure we're always assessing for any incontinence and resolving it quickly. And then history of diabetes, this definitely can cause skin breakdown. We can have delayed wound healing and maybe some decreased perfusion to our skin as well. Head of the bed at 30 degrees, we kind of talked about this earlier. That's a great kind of degree or height for the head of our bed for these clients. We don't want anything that is like too low or too high, anything that's not going to cause like a good weight distribution or put too much pressure on some of those bony prominences. And then option 5, a high protein diet. Protein is great for wound healing. So we would definitely want to encourage high protein for clients that might have a pressure injury or be at risk for pressure injuries. So you guys did great on that one. Well done. And again, thanks to everybody. I see a bunch of people just shared and followed us. So thank you again for doing that. We hope you guys will continue to. We love to see it. All right, question 7. The nurse is talking with a client with acne vulgaris who has a new prescription for isotretinoin. Which of the following statements by the client would require follow-up? Option 1, I will discontinue my oral contraceptive medication this week. Option 2, I will notify my healthcare provider if I notice changes in my mood. Option 3, I should avoid drinking alcoholic beverages while taking this medication. Option 4, I should wear a hat and long sleeve clothing while spending time outdoors. All right, 30 seconds on the clock. Drop those answers in the chat. And I'll just point out again on this question, we see the words would require follow-up. So just to give you guys an early tip, your correct answer is going to be the incorrect statement. So, you know, one thing we always encourage is that you guys just read questions slowly, make sure you take your time, because that can really make or break the question or how you answer it. So just take your time, read it. If you feel like something kind of caught your attention, go back and reread it. Just make sure that you take your time on that so you don't miss questions when you know the content, but just because you sped through it. I'm guilty of that. But you guys are doing awesome. Well done, well done. All right, as you guys are answering, be sure you guys go and check out uworldnursing.com. Again, it's kind of our hub for everyone new to UWorld Nursing. We have our event calendar you can subscribe to. You can see a few weeks in advance all the different topics we're going to be covering. We also have links to some of our kind of most used resources, including our free trial and also our subscriptions. So be sure and check that out. Lots of great content on there. All right, good work, you guys. Okay, our correct answer is going to be option 1. So again, we kind of talked about this, but we see the question asking would require follow-up. So our correct answer is going to be the incorrect option. So the medication we're talking about here is Accutane. So it's an oral acne medication that's derived from vitamin A. It can be used to treat severe cystic acne, but pregnancy is an absolute contraindication with this medication because it's teratogenic. So that means it can cause like spontaneous abortion or even severe birth defects. So clients should use 2 forms of contraception beginning a month before and throughout the therapy and at least a month after discontinuing the medication. So definitely something that's important for our clients to know. We definitely do not want the client to discontinue contraceptive measures without knowing the risks associated with it. So what we see in options 2, 3, and 4, these are correct statements. There's definitely can be some mental side effects with the medication. So if there's any changes in mood, we definitely want the client to notify the healthcare provider so that that can be evaluated immediately. We don't want to drink any alcoholic beverages while taking the medication, and we want to really protect our skin from the sun on this medication as well. We'll have increased photosensitivity. So you guys did great on that one. Well done. Good work, you guys. All right, question 8, last question. I can't believe we're already here. All right, the nurse has attended a staff education program about contagious skin conditions. Which of the following statements by the nurse would indicate a correct understanding of the program? Select all that apply. Option 1, impetigo is transmitted through inhalation and infectious droplets. Option 2, herpes simplex virus can be cured by treatment with acyclovir. Option 3, clients with atopic dermatitis require contact precautions. Option 4, tinea corporis can be spread from animals to humans. Option 5, pediculosis capitis typically occurs near the scalp. All right, 30 seconds on the clock. Drop those answers in the chat. Let us know what you guys think. Again, select all that apply. You're going to have more than one right answer. And I hope you guys kept track of how you did. Let us know how you did out of the 8 questions when we're done today. And also let us know, too, before we leave, what topics you guys are interested in. We always love kind of seeing what topics you guys find most challenging, maybe what tests you have coming up, but we're always evolving our content calendars. So let us know what some of your most challenging things are, whether it's a type of question, a content area, anything like that. We love to see it. So let us know, and we're here for you guys. So whatever you guys need. All right. Our correct answers on this one are going to be options 4 and 5. So again, we're looking for correct understanding. So our correct answers are going to be true statements. So that's one of the ways that we can kind of approach this question. So what we see in option 4, tinea corporis, this is essentially ringworms. So this is something that can be spread from animals to humans. And then what we see in option 5 is lice. And lice typically lay their eggs near the base of our hair follicle on our scalp. What we see in option 1, impetigo is spread through direct or indirect contact, so not from inhalation or droplet. Herpes simplex virus, what we see in option 2, it can't be cured, but it can be managed with treatment, but it'll never be gone. Essentially, it'll just be a measure of the viral load being detectable or undetectable. And then option 3, atopic dermatitis. This is not a contagious thing. This is like eczema, so not anything that requires any type of precaution. So you guys did great on that one. Well done, you guys. As always, be sure and check us out at uworldnursing.com. Check out our event calendar and come back tomorrow. We have another great question drill set for you guys. We hope this was helpful, and we'll see you next time. Bye.